A common story I hear from my patients sounds something like this. I just feel so out of control. It starts with a few chips, and next thing I know, within a matter of minutes, the entire bag is gone. The guilty feelings afterwards are the worst. This feels like a cycle I just can't break out of. This is binge eating disorder and is the most common eating disorder in the US. My name is Dr. Rachel Goldstein, and I am an adolescent medicine physician at Stanford University School of Medicine. I specialize in taking care of teens and young adults. I've treated many patients who have struggled with binge eating disorder. In this video, I'll define binge eating disorder, describe some of the key characteristics of the disorder, and talk about what you can do if you or someone you love is struggling with binge eating. I know this is a topic that can feel incredibly sensitive to talk about, but doing just that can start the process of recovery for those dealing with this issue. Some of the themes you heard about in the intro are really common for folks who are struggling with binge eating. The defining feature of the disorder is the consumption of a large amount of food, often entire full-size bags of chips, boxes of cereal, or packages of sweets that might be upwards of 1,000 calories, over a relatively short period of time. During these episodes, there's generally a feeling of being out of control and intense feelings of guilt and shame. Unlike those who have bulimia nervosa, there is no attempt to compensate afterwards, either by vomiting, exercise, or laxative use. To be officially diagnosed, these episodes need to happen at least once a week for at least 3 months. For those who think someone they care about might have binge eating disorder, some key warning signs can include being uncomfortable eating around others, large fluctuations in weight, low self-esteem, and being overly worried about their body weight or shape. It's important to take a second to distinguish binge eating from overeating. When people overeat, they consume more food than they may have planned to and feel overly full. This is that second helping of dinner, for instance. But A, they haven't actually eaten an objectively large amount of food, and B, they don't have the sense of feeling out of control during the episode. As binge eating often occurs in secret, many struggle silently for years before they're diagnosed and can begin the recovery process. Nearly 3 million Americans have binge eating disorder, making it the most common eating disorder in the US. Binge eating usually begins in the late teens and early 20s and affects women more than men. Those with binge eating disorder may have other mental health diagnoses like phobias, anxiety, depression, post-traumatic stress disorder, or substance abuse. While binge eating disorder is a mental health condition, there are medical consequences. In the short term, the health consequences of binge eating can include things like weight fluctuations, abdominal discomfort, and heartburn. In the long term, largely due to being at a higher weight, patients are at risk for high cholesterol, diabetes, high blood pressure, and sleep apnea. The guilt and shame around binge eating can make it really hard for people struggling with this disorder to talk about it, which is the first and most important step in the recovery process. If you suspect a loved one has binge eating disorder, it's important to approach them from a place that is judgment-free and as supportive as possible. Pick a time when neither of you are rushed or multitasking. You can start out by describing the specific behaviors you've observed that make you worried. For example, I've noticed that you're often going to the kitchen late at night and heard you make negative comments about your body. I'm worried that you might have an eating disorder. Is this something that you're dealing with? Ideally, your loved one is in a place where they can open up about their eating disorder, but this doesn't always happen. If your concerns are dismissed or rejected, it's important to let the person know that you care about them and are here to support them. If they're a minor, it's important to connect them with a medical and mental health provider for evaluation. Effective treatments involve a combination of psychotherapy, nutrition counseling, and medical care. The main treatment is psychotherapy, specifically cognitive behavioral therapy. Mental health providers can help patients identify and reframe negative thoughts about body image and work towards developing a healthier relationship with food. Partnering with a medical provider and dietitian can help address some of the potential medical consequences of binge eating and establish healthy exercise and eating habits. For most people, treatment will take place in the clinic setting, though a small number will benefit from higher levels of care, such as day programs and rarely inpatient hospitalization. For the friends and family of those struggling with an eating disorder, seeing the eating disorder as something separate from their loved one is key in the recovery process. I find it helpful to imagine a Venn diagram where we have the eating disorder and the patient. When the eating disorder is strong, these two circles can really overlap. But over time, we work to split them apart, and it starts with viewing the eating disorder as its own thing. Most patients who receive psychotherapy will have improvement in their binge eating, though they can have flares over time. In general, the longer someone has an eating disorder, the lower the chance of recovery. Help is available for those who need it. Talking to a primary care provider can be a great place to start. As some who struggle with binge eating may also have other mental health diagnoses, it's important to seek help immediately if there's ever any concern for safety, like thoughts of hopelessness or suicide. I've taken care of many patients who have struggled with disordered eating, who were able to recover and develop a healthy relationship with food and their bodies. Acknowledging the eating disorder thoughts can feel overwhelming and is an important first step towards getting help and beginning the recovery process. To get help or additional resources, please check in with your primary care provider.